Thank you all for coming. I'm going to go ahead and get started. I'm using my pad. We were having some camera problems. LaShawn is talking me through my very limited technical expertise here. So thank you very much for your help. How many people we have in the room, LaShawn?
We have 21 people.
All right. So just a little quick about me. I've been the CEO of Big Ben Cares since 2005, and then CarePoint came on board in 2017 as doing business as under the same company. The current and treasurer for UPHS, as LaShawn said. This is my fourth stint as treasurer through 4 different executive directors. So I have been working with UPHS since the actual first initial. I was Kellyotti's treasurer at some point during the first few years, and have been on and off on the board as permitted. Current treasurer for Leadership Tallahassee, as well as a national group called the AIDS Institute, which is located in Tampa and DC. And the vice president of one of UPHS's sort of subcontracts of RWC 340B. So a little bit on both sides, the treasurer side, working with Amber and staff, as well as developing the budget from my own perspective as the CEO. Real quick about our agenda. We're going to go a little bit into budget development and how that aligns with your strategic plan, some financial review information, budget amendments and budget revisions, both in your budget and in to tie into something LaShawn asked me to do, which is grant management, fiscal policies for internal controls, audits and best practices, and then I'm hoping to leave a fair amount of time for questions and answers at the end. That LaShawn will help us get through, since I can't see you with screen share. So getting started with budget development, and the first principle, sort of everything your nonprofit does should align with your agency's strategic plan and mission statement. So you've got a goal or a mission, a vision statement that sort of guides what the agency does and your beliefs. And from that, a strategic plan, ideally, would then tell you what you're working on over the next 3 to 5 years. What does the agency want to accomplish? And then developing your budget each year to incorporate accomplishing those goals of the board and CEO. So I'll give you an example. For us, my board put in my strategic plan purchasing a mobile van to do mobile health clinics. Well, you can't just put it in a strategic plan if I don't figure out how we're going to pay for it. So then you're working through your budget to, is it, it's a 3-year strategic plan. Can I do it this year? Is it possible? How would I do it? Both the revenue that it's going to take to purchase that, but then, and the expense of the upkeep, but also, is it going to generate any revenue? All of that should be part of your budgeting process each year as you move forward. It should reflect your priorities of what services you want to make sure you deliver to your clients, both at the board level and the CEO or ED level. I am a big believer that it should reflect the value you have in your staff, especially nowadays with hiring so difficult in our sector as well as across the nation. You have to budget for that. There's now the state law where minimum wages go into $15 an hour. You're going to have to budget for that. I am a firm believer that the staff delivering the services is just as important as the curriculum that you're delivering or services you deliver to the clients. I could deliver the best medical services, but if my nurses aren't good, top-notch nurses, there's still going to be problems. So all of that has to get incorporated. And what does that look like each year? For us, medical assistants are a fleeting commodity. So I have to reevaluate what is my starting salary for a medical assistant. And pretty much every year I have to realign that to remain competitive. Should maximize the quality and quantity of services offered by your agency. What I mean by that is really what services do your clients need? And then what is the best way to deliver those? But also, how much of it can you do? So if I budget X amount of dollars for transportation, but I need X times 3, that's not going to, my clients are not going to get everything they need. So these are all sort of the starting points of what I do when I'm budgeting. And then, obviously none of us have enough money to do everything we want, and then work backwards from that. And we'll talk a little bit about that later. Your budget should be done in accordance with the timeline necessary for your board to review it and then offer feedback. So if you're a 10-1, which we are fiscal year, I present my budget for the sort of ideas for the budget to the board in June. I'm looking for what direction do they want me to go. Are we doing staff raises? Is there something that they want me to try to accomplish this year out of the strategic plan? And then I work my budget with my finance people to try to incorporate the board's sort of overall direction and feedback as to their vision. And if I can't do it, I come back and say I can't do that. And then I try to have a final draft to them at our August meeting, which gives them 1 meeting to send it back, so that if then again something doesn't look right or they're not satisfied, they have the September meeting to pass the budget, and it all starts on 10-1. So all of that, just getting your timelines. I found that most of the places do not start their budget work early enough. So there's some things that you can't do as it gets closer, like what's your health insurance premiums. But in general, you want to get your baseline stuff done. I would say 90 to 120 days before your budget starts. You can't develop your budget, I don't believe, for it to be effective if it's just you and your finance person or you and your board. So all my departments, my education department, my clinic staff, we all work together individually to say, so what are your needs? What does your staff need as far as training? What's your equipment needs? And we don't have individual budgets. So I have 7 department heads. If I meet with each one of them to relay to me their needs for the year or their wants. I want to go to this conference. I want to do this training. And then I roll them all up together into one number for the finance person and the board. But I don't just make up a number and then say, well, there's $20,000 in conferences. It's first come, first serve. We try to accommodate what the staff of each department wants during that fiscal year so that we can sort of get an idea of what is the total need for the agency. Your budget needs to be realistic and conservative. I think I said I budget for the worst, hope for the best. So if I'm looking for a new grant source, I'm probably going to put it in the budget if I've applied. Say I applied for a grant for $50,000. If I've gotten it every year for the last 3 years, I'm probably going to go ahead and count that as as an expense I'm going to get pretty regularly. If this is the first time I've ever applied for that, I may go ahead and put the revenue in my budget, but I will also not use that revenue for anything outside of serving in that grant. So if that grant has one staff person that I applied to fund and those supplies, if I don't get that grant, it's not going to affect my base operations. You're basically making that grant revenue neutral. So I'm not counting on that grant to supplant other funds or to cover my base budget. I really view it as, if I get 50, I'll spend 50, but if I don't get it, it doesn't affect anything I do other than I won't deliver services in those grants. And then the big one, nonprofit does not mean no profit. I am budgeting to make money, either for reserves or for things that are on the strategic plan that I'm not sure I can budget for, but that if I have enough money, I will do at the end of the year. But I am not budgeting to lose money, and I am not budgeting to break even. It does put the burden on me and the ED and the board with calls to action. So if you're, one of the reasons to involve your board early is if you've taken their wishes into consideration and your base operations and you're $100,000 short, the board needs buy-in that you and they are going to have to do something about that. They are going to have to help you raise money. They are going to have to support you if you have to make cuts to staff or services. But all of that on the front end is a much better conversation than saying, hey, we're 7 months in and I'm $300,000 short. What are we going to do? Don't just cut easy stuff, staff, trainings, supplies. That's the easy way to try to make your budget work. You gotta sort of think outside the box. Is there additional revenue or grants, different fundraisers? And by that, I don't mean have another bake sale. Are there other options for your services, whether that is a different way of doing business, a different partnership, or a grant that really doesn't necessarily do what you do every day. And I put this in as an example. We successfully applied for a grant to do some capacity building internally with Big Bend Cares and the clinic, and redoing our bylaws and doing about a year's worth of DEI training. And the second year, that grant changed and it became an external grant. And what they wanted was for now Big Bend Cares to become the capacity building arm for smaller agencies to sort of do those same things, capacity building, internal growth, but then tie it back to additional HIV testing. And so that really didn't make any sense for me. I don't do capacity building. We already do HIV testing. It didn't work for us in our traditional services. But in talking with Amber and UPHS, we came up with an idea that we would write the grant. UPHS would provide capacity building for 3 small grassroots agencies who have never been funded before to do the work that they already do. So whether that's food distribution or community outreach, another one did reentry program, and that Big Bend Cares would come behind and offer testing in those sites. And we were successful in that. LaShawn did a lot of the capacity building herself, so she is aware of that as well. But it brought in money, even though we were not doing anything that we don't already do, but brought in outside partners. And then that grant, because we were doing that, we utilized that grant and the work we were doing to apply for another grant for $500,000. So you got sort of sometimes have to twist the things. Big Ben Cares never really did anything except HIV testing and education. So not really mission creep for us, but it incorporated other people, got funds in the community, and then brought in additional funds for us to expand our services sort of on a very roundabout way that is sort of very non-traditional for us. And we had never tried that before, but it was very successful. So moving on to fiscal review, your financials should be presented to the board at every meeting, whether that's once a month, once a quarter, every other month. You should have up-to-date financials for your board to review at every meeting. If you go down to the last one that's sort of cut off, and by financials, I don't mean it's an Excel spreadsheet that somebody has typed in the numbers to. It should be a report that's right out of your financial software, whether that's QuickBooks, Blackbaud, whatever you use, that's where your report should come from. The treasurer should review and present it to the board. As you get bigger or more complicated, sometimes the treasurer, who is just a volunteer, might not have the capacity to present all the ins and outs. So the CFO could do it, or if you have an outside bookkeeper, they could present to the board. What you don't want is one person doing everything. The CEO shouldn't make the books, present the books, review the books, and tell everybody about the books. Because if you get in trouble, there's no separation of duties or cross-checking, and we'll talk about that a little bit later. Use your footnotes and overages, and I'm going to just go ahead, and this is very blurry, but I couldn't make it any better. In this format, the left-hand column, it would be what is the actual for the month. The second column would be what is budgeted, and then what is left, and then there's percentages on the outside. So if you're 6 months in and you're over 50% on expenses or under 50% on revenue, these should be triggers or conversation points. I put footnotes in mine to sort of explain those things before when I send out the financials, so that people can ask their own questions or find their own answers. It also helps, I found that board members review more if they're just looking at numbers, but there's also explanations for those numbers. So it doesn't have to be this format. It could be dollars, it could be percentages. You just want to show anytime there's a discrepancy. Are you running short on revenue? Are you running over on expenses? That's a discussion that should happen at the board meeting when you're going over financials. And then, do you have a finance committee? I know a lot of places put financials on the consent agenda. They should not be on your consent agenda if you don't have a treasurer or finance committee that reviews them first and is then, so that there is some board review of the financials. That, to me, that's a little glossed over. You don't want to just say, yep, here's the finances, all good, and we'll put that on with the minutes and everything else, and we just approve it without discussion. So whether that's a separate finance committee or there's a treasurer's review, and they are then presenting that as, look, this committee's already reviewed it, then you could put it on consent. but not if it's not had a secondary review. And then real quick, what's the difference between a budget revision and a budget amendment? So a revision is really taking the same dollar amount and moving it around. So if my contract or my budget is $100,000 and I'm short in the personnel line, but I have money in supplies and just move from one to the other, that's a revision. An amendment is a revision of your total dollar amount. So the state is going to give us an extra $25,000, or they cut your contract by $20,000. You're going to have to redo your entire budget to accommodate a new total. And I think part of this is grant management, in managing your contracts and grants, whether that's with the city or the county. I know they allow budget revisions and budget adjustments of 10% in a category, but I find that a lot of agencies do it for their contracts, but they don't do it for their annual budget. Why not? If you have found that your 3 case managers or 3 direct line staff have left, and to replace them is going to cost me an extra $15,000, but I don't have that in the budget, then go ahead and revise your budget. Do you have $15,000 that you could take from other line items and put into salary? That way your board is aware that, look, this is the cost of doing business today versus the budget, which is really just a projection that you're sort of guessing at maybe 6 to 8 months ago. So just keep that in mind. Next subject is really internal controls. So at a certain point, you have to get an audit. Not everybody is required to do so. Sometimes it's just a fiscal review. It can vary based on your state and federal funding. Whatever that looks like for you and your agency, you just want to make sure that you say what you do what you say. Whatever your policies say you do those. If your policy says X, but you found that Y works better, I have often found that people say, well, we were supposed to do X, but Y works so much better. But you didn't go back and change your policy to say, now we're doing Y. That end piece is very important if you're being audited, because they're going to audit your fiscal policies as well to see that you're following what you do, and what you say you do is the practice. For small agencies, especially, involve as many people as possible into the process, and don't hesitate to use your board members, whether that's your board treasurer, your board president, board secretary. All kinds of people can be involved in your internal controls. So it could be your receptionist. There's a person that answers the phone. They could be logging in checks and deposits that come in. And that's separate from your finance person, who maybe is going to deposit those checks. The treasurer could be the one opening the bank statements. Third-party accounts payable can communicate with the treasurer to make sure the deposits and bills being paid out match the receipts that are given. Your board chair can be part of this. A contracted bookkeeper can be part of this. If you give different jobs to different people, so that it's just not one person who, I received the checks, I signed for the checks, I deposit the checks, and then I tell you what checks I got. Is all vital in trying to ensure that you have not only a clean audit, but that you do your best due diligence to prevent fraud or illegal activities. If somebody really wants to commit fraud, no matter what we do, they're going to be able to do it, because they're going to, it's like a uh, rat in a maze. If you give them long enough, they're going to figure out where the cheese is. What your job is to detect it as quickly as possible and do as much as you can to prevent it. We talked a little bit about this as far as audits. It can be a state or federal. You can have city or United Way funds that may require an audit. You should have an audit committee in place. Current rules for an audit committee is it should not be anybody who signs checks. So if you've got officers that sign checks, they should not be on the audit committee because they in fact could then be one of the ones committing fraud. Your audit committee should report directly, your contracted auditor should report directly to the audit committee. So my board of directors puts out the RFP, the audit committee decides on who the auditor is, they hire the auditor, they meet with the auditors, both for an entrance interview and an exit interview. And then me and my staff do a lot of the office work to provide them with the things they need. But when they've completed their findings, they report that directly to the board of directors so that you're really keeping me out as the filter. You don't want to filter what your auditor is saying or have the executive director have the ability to filter out, especially if that's the person where the problems are.
We do have a question real quick regarding.
Sure.
So the question is there a conflict of interest to have the finance committee review the audit? And in this situation, the chairperson is not the check signer.
As long as the finance committee doesn't have a check signer. So if you're a check signer, you have the possibility of signing checks that could be the fraud issue. So your best practice would be not.
Rob, did we lose you? Sit tight, everybody. I think we are having some technical difficulties. All right, you're back.
Did I come back?
You're back now.
All right. So did that answer the question?
Yes, they replied, thank you.
So, if your board is really small, that might not be an option. If you can, that's great. But, some boards, only 4 or 5 people, and you have 3 check signers. Your audit committee really needs to have at least somebody who understands the audit. Otherwise, it's sort of screen again.
All right, you're back.
Can you see the screen?
Yes, we can see it.
Okay. And then grant management. When you've gotten your first grant, whether that's a city or county, they will give you a list of allowable and unallowable costs. Follow it. When you start submitting grant receipts and stuff that are reimbursable, when you send in stuff that they then have to weed through your stuff and call you back and say, no, we don't pay for this, and no, we don't pay for that, just follow what they give you to the letter. When in doubt, the answer is no. And there's a reason for that. If you, I strive to be the star pupil. Everybody's heard of the 80-20 rule. They spend 80% of their time dealing with 20% of the agencies that are the problems. Everybody who's working on grant reimbursements is not going to be the highest paid person in the world. They are looking for less work, and they don't want to spend all their time dealing with problem children. And whether it's fair or not fair, whether it's what should happen or shouldn't, their attitudes affect the people who then decide who gets the money. When they say, oh, well, let's go ahead and refund LaShawn and UPHS, and the people who deal with your reimbursements go, oh my, and roll their eyes because they have to deal with LaShawn's bad receipts every time, that affects you. So on a positive side, if everything is going really well, you are going to have an opportunity to get additional funding. So I think that it works both ways.
All right, another question here.
Yep.
This one is, can the audit committee or finance committee serve both roles?
Yes, if need be. But I would chair, the finance committee really should be chaired by the treasurer, and I would have someone else chair the audit committee, but they could be the same committee. Does that make sense? Is that a yes? All I see is your head, LaShawn. That's the only thing I can see.
Yes, they're good. That's a thumbs up.
A big one is take as much time doing your monthly reports correctly as you did to write the grant to get the money, and be on time. I cannot tell you the number of times that just by turning my reports in accurately on time, that we have actually been asked, now you are going to apply for this again next year, right? Funders appreciate that, and it can lead to additional opportunities in the future. So it's just as important when you're getting your reimbursements and it's time to get paid as it was to get the grant in the first place. And this is for those of you who have state grants. Staff turnover at the state level is at this point in almost epidemic proportions. It is difficult to get assistance from the state. And if you've been in your position for a while, you are probably outlasting most of the state employees there. If you're on time, accurate, they're going to come to you for advice, and ideally be the last ones that they come to cut. So again, I really like to emphasize we spend a lot of time in nonprofits trying to get grants, but we don't spend enough time making sure that once we have them, we're delivering the services we said, and that we're reporting and our reimbursements are just as on point as the services we deliver. So my little soapbox is the fiscal operations of a nonprofit are as integral as the services we deliver to the clients. If you are not fiscally sound, using fiscal best practices, no matter how good your services to clients are, at the end of the day, we all know you can't deliver services without money. So managing that money and having best practices in how you manage money is just as important. And it's not everybody's cup of tea. So just, if it isn't, that's perfectly okay. You just need to access people who that is their cup of tea, and figure out, know your strengths and weaknesses. And if this isn't it, then get people on board or through contracts. It's very reasonable to hire bookkeepers to help you with this kind of stuff. And I know UPHS and LaShawn often help as both the fiscal agent and helping them link to bookkeeping services. LaShawn and Amber and UPHS don't have their own bookkeeper. They use an outside service. And that works great for a lot of agencies. And with that, I will answer any questions. And thank you for this opportunity.
So I know people message me privately. If you have any questions, you can drop them in the chat, or you can feel free to come off mute. I'll tell you, and Rob referenced it, we do a lot of capacity building, and these are the areas that a lot of people are needing support in. And a lot of people haven't been able to get funded because the fiscal aspect of their agency is not where it needs to be, as far as policies, procedures, and those type of things. So feel free to ask any questions you have.
Good afternoon. This is Winnie from the Elsa Prevention Fund. Hi, Rob. It's been a minute.
Oh, how are you?
I'm doing well. Thank you. Great presentation. Appreciated it. And appreciate you saying what you said about staff and paying staff what they're worth, and how important fiscal is to the operations of any organization. I appreciate that. So true. So very true. I also want to add just a bit about the amendments. And for us, amendments, even though we don't change the total, if you add a different line item, if you add a new expense, the amount may still be the same. But if you're adding a new line item for a new expense that you didn't have in the original budget, that would require an amendment as well. So, but otherwise, if you're not changing the amount and you just, moving money around, most of the time they'll let you do a revision or adjustment, as you said. But if you're adding a new line item or taking away something, replacing it, changing it, and then that way, they might ask you for an amendment, to do a formal amendment to add that new line item, new staff person, or new expense to the budget. But thank you so much. Good to see you too.
It's great to see you. It has been a minute.
Any other questions? And as mentioned, someone inboxed me. We'll send out kind of a draft budget sheet. I've seen different variations. The one Rob referenced on the screen is the one that we pretty much prefer member agencies to use, because it's best practice. Not that it'll be exactly like that, but I know for some people they're using various documents, and you definitely want something that's already been approved. Any other questions?
This is Gina. I have a question.
Sure.
And no, I don't, and I'm not sitting on a board that has a concern. Let me preface it that way.
Sure, you're not. No, just
Oh, Gina, sure. That's what they all say. You're asking for a friend.
No, I'm not. I just, I've had other people come to me. And so the question is, are there some core steps that if you have a concern about the financial aspect as a board member, or the board has concerns? Obviously every unique situation is unique when it comes to that, but are there by any chance some like core do's and don'ts? Just asking.
When you say core do's or don'ts for, like, you're not getting financials, or you're seeing them and you're concerned, what could you elaborate? Did you go away?
Gina.
If you're talking, you're on mute.
Yeah, I apologize. Yeah, you're seeing them and you have some concerns, and the board's asking questions, and then information's not matching up. You're having to dig deeper and deeper and deeper. And I've had other, not myself, but then have people come to me and say, well, we've dug this far and we still have concerns. I was just looking at, just because people have come to me before, because I do a state agency's budget and I sit on boards. And I was just curious if there were any like just basic do's or don'ts or do's or action steps, some generic ones.
I mean, you could have somebody do an independent review. That, you know, it's sort of different than do some forensic accounting, but there's people who could just do a review of the books and see if you could get your questions answered. I am a big believer, and I still see Winnie's pictures on my screen, and I'm going to watch her head. Where there's smoke, there's fire. If you're concerned and you're not getting answers, I would not stop until I got the answers I was, and until I felt comfortable that the answers matched the facts. Because at the end of the day, it's you, the board, that's responsible. So you have to do whatever it takes for you to get the answers, and that you're comfortable that what you're seeing is matching up with what you're being told. I think part of that, you know, what are your financials look like? Is there a cash flow sheet? Is there a balance sheet? Are you looking at month over month or year over year cash? Because you know, your financials may say one thing, but all the cash is draining out of your bank. Is that matching up? So if you don't have an expert on the board, or you're not the expert, I think you ask questions until your questions are answered.
Okay, thanks. That's pretty much what I've advised people when they've asked me. But I just was curious, but I appreciate you answering the question.
My pleasure.
Thank you. Any other questions? All right, well, we're gonna give you all a little time back. All of our UPHS trainings are actually on our YouTube channel. We got, you know, younger generation staff member working here, but they're on our UPHS channel, YouTube channel, as well as Facebook. Some of you have emailed directly. We'll get a draft budget sheet to you, and Rob will probably share a PDF version of the slides. But if you have any questions, as always, feel free to reach out. If you need any support, reach out. I see a couple of new EDs on the Zoom. If this is an area of growth for you, reach out. We will definitely partner you with someone like Rob or one of our seasoned EDs who have been doing this for a while, who have consistently been able to get funded to try to make sure that we address the areas that you need assistance in. So you all be well, be safe, and we will see you soon. Bye, everybody.
Thank you all.